Hello, this is Dr. Don McDonald from South Side Chiropractic. Hello, Edmonton. Just a question. If anybody out there is suffering from arthritis in the hip, this video is for you. Also, if you've had a hip replacement or you're waiting for a hip replacement, this is for you as well. What typically happens is when we start to get injuries or we sit too much or we've been under a lot of stress, our body goes into a flex posture. And when our body goes into a flex posture, what happens is our hips start to rotate inwards. And when they start to rotate inwards, we start to get really tight down the inside of your adductor, so the inside of that groin. Sometimes it can pull into the knee. And also often we can get a pinching right in the front of the hip. And it's just really hard to move that around. So we just kind of get constantly tension there. Also, sometimes we get lots of tension down the front of the quad. Now, again, it's always best to try to prevent stuff. So over time, we want to make sure this is moving proactively before we start to get degeneration. But even if we do have degeneration, it's still really important to keep this hip moving and make sure the pelvis is moving as well. Once you're waiting for a hip replacement, because we've seen a lot of, especially during COVID, we had a lot of people who got canceled off the wait list and they had a degenerated hip and they had so much discomfort, it was hard for them to move around. And we are still able to help them to keep them functional while they're waiting for a hip replacement. Now, if you've had a hip replacement, sometimes after things have healed up, still the only difference is basically the ball has been replaced. So the joint still needs to work the same way as it did before the hip replacement. So if you're having any challenges with your hip, we'd love to take a look at it. So give us a call at South Side Chiropractic. Dr. Kyla, Dr. Josh, and myself would love to look after you. So hope to see you here soon.